Hi guys, Dr. Mahendran J of Forensic Medicine and Toxicology here for the discussion of recall questions of forensic medicine asked in the session INI-CET November 2023. We got around 12 to 13 questions of forensic medicine, but out of which majority of the questions are easy to moderate level difficulty. One questions for little higher difficulty, we'll discuss that. And most of the questions are from regular high yield topics of INI-CET. Right, so we will discuss all the questions with a lateral explanation. There may be some variations in the actual phrasing of the questions, doesn't matter, let's focus on the concepts. A young female presented with altered sensorium, pinpoint pupil, what is the possible cause? We can look at the options. Cocaine, no, because cocaine causes dilated pupil. Datura also causes dilated pupil. Opium causes pinpoint pupil. Amphetamine, you know that it causes dilated pupils. All the remaining options cause dilated pupils. Only one that causes pinpoint pupil, that is or opium. Let us look at the discussion of the options. When you see cocaine, remember cocaine, it stimulates the sympathetic activity of the body. When I say it stimulates the sympathetic activity of the body, remember it increases the vitals. When it increases sympathetic activity of the body, all the vitals will be stimulated. The heart rate will increase, respiration will increase, temperature will increase, BP will increase, everything will increase. You look at the sweating will also increase. And look at the pupils will be dilated pupils. Pupils will be dilated. The next option that was given was datura. Datura is cholinergic or anticholinergic? Remember, it is anticholinergic. When datura causes anticholinergic symptoms, remember we know that it produces all Ds. We have 8 Ds that we have discussed in the regular videos, right? But here we can remember it produces dilated pupil. It produces dilated pupil. It produces dried secretions, dry mouth, dry skin, all the things are dry. And it also causes delirium. Right? Underline delirium, that is important because datura is a delirium poison. It's a delirium poison. And talking about opium, that is morphine specifically, if you see morphine, you should be having what is called as CPR. What is a CPR? Remember, C for coma. The person will be having pinpoint pupil and the person will also be having respiratory depression. The person will also be having respiratory depression. If you find the CPR in a poisoning, you can easily find out that it is morphine poisoning. And you know the antidote. What is antidote for morphine? What is antidote for morphine? Antidote for morphine is naloxone sodium. Right? We have to give what is called as naloxone. What is the antidote for datura? Datura, we have to give 5-so-stigmine. And cocaine, we need to give amyl nitrite. Right? So these are the antidotes given for all these situations. Fine. So let's go forward. Let us look at the next question. 25-year-old man was brought to the casualty in a semi-conscious state due to road traffic accident. Which type of injury is unlikely to be seen in this person? Right? Unlikely, which is not possibly seen. Multiple contusions, yes. See, RTA, first thing that you have to remember is more likely to be a blunt force trauma. So when you see RTA, the patient should be having contusions, yes. Patient will be having grazed abrasion, yes, because when the person dragged on the rough road, you will have grazed abrasion. Laceration, yes, laceration is possible, but chop wound is not possible. Chop wounds are possible with heavy, sharp cutting weapon. Right? Heavy, sharp cutting weapon. So chop wound is not possible. This is a very easy question. Such an easy question, provided you should know the basics of this injuries, mechanical injuries. Blunt force injuries, sharp force injuries. When you know the blunt force injuries, we have abrasion, contusion, laceration, and fracture. Sharp force injuries, if it are light cutting weapon, that is incised. If it is heavy cutting weapon, it produces chop. Any weapon with a pointed end, that produces stab. So this is the basic content that you need to remember. If you know this content, then you will be able to apply this in the question. Now coming to road traffic accident as such. Imagine that this is an RTA where the pedestrian hit by a car. When the pedestrian hit by a car, the first impact with the vehicle, right? The first impact with the vehicle, injuries produced due to first impact with the vehicle, that is called primary impact injury. Usually the most protruding part of the vehicle will come and hit the person. That is usually the bumper. We get what is called as bumper injury, which is also the primary impact injury. Why this is called primary impact injury? Because it is the first impact with the vehicle. In bumper injuries, you will get abrasion, you will get contusion, you will get laceration, you will also get fracture. That is very important. We call it as bumper fracture, usually seen in the legs, right? So now when the person was hit by a car, the first impact with the vehicle, then the person falls on the vehicle. This is called second impact with the vehicle. Injuries produced due to second impact, that is called secondary impact, wherein the person can fall on the windshield or bonnet, whichever part that is in contact with the car, the person can get injured. Secondary impact. Then the person falls on the ground. When the person falls on the ground, due to the ground impact, the person will be dragged on the road. This is called tertiary impact injury. Remember, tertiary impact injury is also called as secondary injuries. We discussed about primary impact, that is first impact. We discussed about secondary impact, that the person falling on the vehicle, that is second impact. When the person falls on the ground, that is called tertiary impact, which is also called as secondary injuries. And this is the situation wherein the person can have multiple extensive grazed abrasions can be noted, because the person is dragged on the rough road. The person can have extensive abrasions on the body. They can, in one of your previous R&D question to us, ask extensive abrasions on the dead body of RTA is dash. Primary impact, secondary impact, and secondary injury. Remember, it is secondary injuries. So let us focus on the next question. All the following can be used for identification of a dead body, except we are going to identify the person. How will you identify the person? If you want to identify the person, you can go for what is called as DNA analysis. This is the most useful one. And here, which of the sample is used for DNA analysis, which of the sample is not used for DNA analysis, right? Do we use muscle for DNA? Yes. Do we use muscle for DNA? Yes. Do we use blood sample for DNA analysis? Of course, yes. Do we use teeth for the DNA analysis? Yes, of course, because we have the dental pulp. In the dental pulp, we have the DNA sample. With that, you will find out the identity of the person. Which is not used? Nail is not used. Nail is not used for DNA analysis. When you look at the samples, we have variety of samples from which we can find out the DNA. Teeth sample, bone sample, hair follicle, blood, saliva, the buccal smear, and semen. Even from the DNA, you can find out the person, that is from the spermatozoa. That can also be identified. Right. Now, suppose we need to discuss in terms of dead body. During autopsy, if you want to do DNA analysis, what are the samples that we have to preserve? Suppose if it is a fresh dead body. Remember, if the dead body is fresh, you're going to do autopsy. During autopsy, you're dissecting the dead body, what samples that you have to collect. If the dead body is so fresh, we can collect blood sample itself. Simple one. Suppose if the body is decomposing body is not decomposed, it is decomposing, in which you can preserve muscle, or you can also preserve spleen for the DNA analysis. What if the body is completely decomposed? If the body is completely decomposed, the bone becomes, it completely, you have skeletonized dead body, you can have bone. Sometimes if you are able to find out the teeth from the dental pulp, you will be able to identify. Right. So remember, these are the samples that you can use during autopsy depending on the decomposition status of the dead body. Suppose you are going to preserve the blood sample for the DNA analysis. What is the preservative that we have to use? We need to use what is called as EDTA. Right. But remember, if you're going to analyze toxicology from the blood sample, you cannot use EDTA. Instead, you will use sodium fluoride. We have to use sodium fluoride, we have to use potassium oxalate if you're talking about the poison analysis. Since it is about DNA analysis, we are going to use anticoagulant, that is EDTA. Right? So remember, this is important. We can be expecting in the future examination. Cadaveric spasm is absent in dash. What is cadaveric spasm? Cadaveric spasm is also called as instantaneous rigor. Cadaveric spasm is also called as instantaneous rigor. One group of muscle which was contracted at the time of death continue in contraction after death also. Right? So you can see one group of muscle will be in spasm. That is most important. When you talk about cadaveric spasm, in which condition you see that? Normally what we used to read drowning. Cadaveric spasm in the case of drowning, for clenching of grass tightly in the hands of the victim. But that is not the only case. Suppose when a person commits suicide, he takes a gun, shoots himself. When he shot himself, you can see the gun will be held tightly in the hand. Suppose if it takes case of electrocution, the person held the wire, he got electrocuted, the wire will be held tightly in the hand, grasped tightly in the hand. That is also cadaveric spasm, in which case it is not seen. In traumatic asphyxia, it is not seen. That is the answer. What is traumatic asphyxia? Traumatic asphyxia is a condition due to some weight of the body, the person is unable to move his chest. There is restriction of chest movement. When there is a restriction of chest movement due to mechanical fixation, if the person is unable to move the chest, because of which if the person gets asphyxiated, we call this as traumatic asphyxia. Right? Mechanical fixation, but heavy weight, building collapse, stampedes, all these things are traumatic asphyxia, in which we do not see cadaveric spasm. Sometimes these are all the conditions where you can see this cadaveric spasm. You can see this is a gunshot wound, this is the gunshot wound, this is electrocution. Here you can see the drowning victim. You can see that which we have discussed in detail with regard to the main videos. Now let's look at the differences between rigor mortis and cadaveric spasm. You will be able to differentiate when you know the concept. See, cadaveric spasm, I told you, this is also called as instantaneous rigor. Right? Instantaneous rigor. That means it occurs immediately after death of the person. What about rigor mortis? Rigor mortis is also called as cadaveric rigidity. Remember, it is rigidity, not spasm. That is one thing that you have to remember, because in the question they'll try to confuse you by swapping these terms. You have to know this. Muscles. In a case of rigor mortis, both voluntary muscle and involuntary muscles are involved, whereas in a case of cadaveric spasm, only voluntary muscles are involved. Only. And onset, remember, it starts in 1 hour, right? Because before rigor mortis, we have something called primer relaxation. But in cadaveric spasm, there is no primer relaxation. You have to remember, in case of cadaveric spasm, there is no primary flaccidity of the muscle. So when I say when there is no primary flaccidity of the muscle, it occurs immediately after death of the person. It occurs immediately after death of the person, and that is the reason why this is called instantaneous rigor. Instantaneous rigor. What are the sites where you can see? See, rigor mortis is something that is generalized. It is seen throughout the body. Whichever muscle that you've got, every muscle will be undergoing rigor mortis. But cadaveric spasm, it depends on whichever muscle the person was using at the time. Right? One group of muscle. It is involving one group of muscle only, whichever muscle it was using at the time. One group of muscle was involved. Whereas in case of rigor mortis, it affects every muscle of your body, that is generalized. As I told you earlier, in a case of rigor mortis, you will be able to see the primary flaccidity, whereas in a case of cadaveric spasm, there is no primary flaccidity. That itself will be given you as a key point in the question. So when you see any condition, there is stiffening of the muscle without any primer relaxation, you can always think that it is cadaveric spasm. Remember, that is very important. Antemortem or postmortem. See, rigor mortis is postmortem phenomenon, whereas cadaveric spasm is antemortem phenomenon. It is always antemortem. You cannot produce it artificially. You can't produce it artificially. It is always antemortem only. Now again, the match the following type, right? So INI-CET is question. Every session you tend to get at least one match the following type question in forensic medicine. So now this is about, usually you get match the following type in the injuries. They'll give you the name of the injuries. They'll give you examples on the other side. But this time they have given you match the following from the toxicology aspect. The classification, we'll discuss about the classification. See, nicotine is also called as tobacco. It acts on the cardiotoxic system, cardiovascular system. Whereas datura, remember, datura is a delirium. We discussed just now, datura is a delirium. It acts on the CNS. Nitric acid is a corrosive. Remember, corrosive acts on the skin topically, whereas nux vomica, it is a spinal poison. It acts on the spinal cord. Right? So when you know this basics, you'll be able to find out which option is correct. Right? We can say A2, B3, C4 and D1. Right? This is the correct answer. But remember, this Nux vomica, Strychnos nux vomica, is a spinal poison, but that is not the only spinal poison. We have what is called as gelsemium. Gelsemium is also another spinal poison that you need to remember. It was asked in one of your previous INI-CET examination questions. Gelsemium. Spinal cord is specified in which of the following poison? Strychnos nux vomica was not given in the option. Instead, gelsemium was given in the option. So we should know that. And what are the other cardiotoxic poison? We'll have to see what are the other cardiotoxic poison. We'll see that. We have the mnemonic called cardona. Right? We have what is called as cardona. D for digitalis. O for oleander. When I tell you oleander, this can be a pink oleander. This can also be a yellow oleander. Remember, pink oleander is called as Nerium odorum. You may not be expecting the common name. Sometimes you can get the scientific name as well. Pink oleander is called Nerium odorum, whereas yellow oleander is called Cerbera thewachia. Right? So when they ask this Cerbera thewachia or Nerium odorum, remember, don't get confused. It is nothing but oleander only. Then we have got N for nicotine. Nicotine is nothing but tobacco. And the last A for aconite. These are the 4 cardiotoxic plant that you have to keep in mind. Cardiotoxic plant. And if you get a case of cardiotoxic poison, you have to preserve the heart while you are preserving the organs for poison analysis. Right? So remember, this is important. See, normally in INI-CET questions, INI-CET sessions, we tend to expect a little higher level question, particularly with regard to concepts or with regard to updates, any advancements in the field, they tend to ask. But this question does not fit into any criteria of INI-CET at all. This is an 18th century question. Right? In 18th century, British East India smuggled which of the following drug to China? I don't really know in what way that is relevant to the medical practice right now. But still, we need to answer this. So, answer is opium. The British East India was smuggling opium to China in exchange of tea, silk, porcelain and all. So, this was one very common smuggling that was happening during the 18th century. That is opium. Right? And as I told you, I don't really know what is actual relevance between the current medical practice and the smuggling that was happened in the 18th century. Which of the following is not a grievous hurt? Right? So this question was asked in 2023 INI-CET November, but now from July 1, 2024, we have the latest legal code that is coming out, that is BNS. BNS is Bharatiya Nyaya Sanhita. Bharatiya Nyaya Sanhita. Whereas earlier, before that, we had IPC. The grievous hurt is given by 320 IPC. The grievous hurt is given by 320 IPC, whereas when you talk about BNS, it is given by 116 BNS. 116. Remember, this is important if you're appearing for the future examination. The 8 classes remain as it is. 8 classes remain as it is with one minor change. We'll discuss about that. Right? First, we'll discuss the explanation, then we'll come back to the answers. Emasculation. I told you for grievous at IPC, this is 320. For BNS, it is 116. Emasculation. Loss of potency of a male. Permanent loss of sight of either of the eye. Loss of sight. Permanent loss of hearing of any of the ear. Hearing. Loss of hearing. Privation of any member or joint. Privation of any member of joint that is totally lost, or else power alone is lost. Destruction of powers of any member or joint. Disfiguration of the face. Any fracture or dislocation of the tooth. You have the 7th class. 8th class is very important. Any hurt which endangers body life, or the person was in severe bodily pain, he was unable to do his ordinary pursuits for a period of 20 days, it was grievous hurt. 20 days it was grievous hurt. For 116 BNS, it is not 20 days, remember, it is 15 days. Right? So this is the change that you need to keep in mind for future examination. So now going back to the question, which of the following is not a grievous hurt? We'll talk about that. Which of the following is not a grievous hurt? Femur fracture. Fracture is a grievous hurt. Emasculation, grievous hurt. Unilateral permanent hearing loss, whether it is unilateral, bilateral, doesn't matter. If it is a permanent hearing loss, it has to be grievous. And hospital admission for a week. Hospital admission for a week. 1 week, it is not a grievous, right? It should be 20 days as per IPC. It should be 15 days as per BNS. So anyway, it doesn't come into the, anyway, it doesn't fit into the criteria. So this is not a grievous. Easy question. An autopsy was performed on a person with history of drowning. However, the report revealed there was no water in the lungs at all. People call it as dry drowning, right? So what is the most likely cause of death? Remember, we have something called dry drowning. In dry drowning, what happens? There is reflex vocal cord spasm. When there is reflex vocal cord spasm, the person will die of asphyxia. See, when the water suddenly enters into the airway, the vocal cord reflexly closes. Right? When it closes suddenly, not only the water, even air can't go inside. When the air cannot go inside, the person dies of asphyxia. Your answer should be laryngospasm if it is dry drowning. In case, if the person suffers from freshwater drowning, remember, in this condition, the person will have what is called as hemodilution. Right, because water movement will be from the alveolus into the blood. So hemodilution will be there. The person will be having hemolysis. When there is hemolysis, there will be hyperkalemia resulting in cardiac arrhythmia. Right, so you can remember this is due to freshwater drowning. Hemodilution, hemolysis, hyperkalemia, and freshwater drowning. Electrolyte anomalies. Suppose if it is saltwater drowning. In case if it is saltwater drowning, we do not get hemodilution, instead we get hemoconcentration. Right? The fluid movement will be from the blood into the lungs. The person will suffer from pulmonary edema. Not only that, in the blood, if you look at it, there can be increase in the sodium, there can be increase in the chloride level, there can also be increase in the magnesium level. All these level will increase. So with the given options, if they ask you for saltwater drowning, you should choose A will also be there and B will also be there if they're asking for saltwater drowning. In case they're asking for another important condition, that is called hydrocution. Remember, hydrocution is normally seen with cold water. I think in one of your previous examination you got this question. What is the cause of death in hydrocution? The cause of death in hydrocution is vagal inhibition of heart. Right, the vagus will stop the heart, vagal inhibition of heart. The person will suffer from cardiac arrest. Right, so that is called hydrocution. These are the primary things that we need to know with regard to the mechanism, pathophysiology of drowning. Right, so drowning is one area where you tend to get questions on INI-CET very, very often, particularly about the pathophysiology. Whatever we discussed, remember hemodilution, hemoconcentration, all these pathophysiologies you have to keep in mind. If at all they ask you questions on drowning, you should be able to answer with this data. In a firearm injury, blackening surrounding the gunshot injury is due to dash. Such an easy question. You know very well, if it is blackening, it is due to the deposition of smoke. Let's see what are the discharges coming out of the gun. What are the discharges coming out? You get flame coming out, smoke coming out, gunpowder coming out, unburned gunpowder coming out, and the bullet coming out. What are the effects of this? Flame produces what is called as burning, right? Charring, not only charring but also singeing of hair. Blackening produced by smoke. Smoke produces blackening. And remember, the unburned gunpowder comes at a high velocity. It gets deposited into the skin layer. We call this as tattooing, also called as peppering. And bullet produces punctured wound. It also produces grease collar, abrasion collar. Remember, grease collar is due to grease deposition, the lubricant deposition around the margin of the wound. Whereas abrasion collar is due to the gyroscopic effect of the bullet. What is that gyroscopic effect of the bullet? The bullet is spinning. When the spinning bullet enters into the skin, it grooves the skin itself. Around the margin, you will see an abrasion. That abrasion is called abrasion collar. Right? So remember, the bullet produces three effects. One is punctured wound. We have grease collar. We also have abrasion collar. In one of the examination, they asked about the synonym of grease collar. Grease collar is also called as dirt collar. It is also called as bullet wipe. Right? In one of your AIMS exam only, they ask this question. Bullet wipe is due to dash. It is nothing but it is due to grease or lubricant. That's called bullet wipe, which is nothing but the other name of grease collar. A 13-year-old female was brought by a mother to the emergency with abdominal pain for a few days. On clinical examination by the registered medical practitioner, they found that she is 8 weeks pregnant. What should be your next best step? Immediate step. What next you should do? Remember, the key words here are she is a minor that is only 13 years old. Not only that, she was found to be pregnant already. Examination is done. She was found to be pregnant. Preserve the clothings. Why do you want to preserve the clothings now? See, clothings are preserved particularly in a case of recent sexual assault so that the evidences can be preserved and whatever stains that can be in the clothing, all these things you can analyze it. Right? And here she is already 8 weeks pregnant. What is the point of preserving the clothings here? There is no point at all. You need to be little logical. You need to think logical, and you need to answer. You need to apply your common sense. Obtain consent from the mother for genital examination. Why do you want to do genital examination here? She's already been examined and already she has been diagnosed to have 8 weeks pregnant. What is the point? If she's a recent sexual assault, you can do genital examination for the purpose of preserving vaginal swab. Right? But here she is already 8 weeks pregnant. There is no point of taking vaginal swab and all. There is no point at all. File an MLC, inform the police. That is very important because she is a minor. Found to be pregnant, it is a crime. It is amounting to what is called as statutory rape. Right? Sex with a girl less than 18 years with or without consent. Right? It is amounting to statutory rape. Or you can also say it is a case of penetrative sexual assault as per POCSO Act. POCSO Act. And remember, plan or perform MTP. We can plan or perform MTP. That is the later step, not immediately. First file an MLC, inform the police, then you can plan for MTP or you can perform the MTP. That is the next step. Right? The immediate step should be inform the police because it is an offense coming under POCSO Act, because if you are not informing any of this information to the police, the doctor himself will be punished for non-reporting. Right? Because as per POCSO Act, the reporting should be done mandatorily. Inform the police. Right? Any person who knows about the offense or who suspects, even if there is any suspicion, you have to inform the police. You cannot say that it was not a confirmed offense. There was only a doubt. There was only a suspicion. Then why should I inform the police? It's not like that. Whether the crime has occurred, committed offense, or if there is any suspicion of offense itself, it is important for the person to inform the police. And if there is any failure to report, it is punishable under 6 months imprisonment, jail. Right? And if the person happens to be head of the institution, it carries even higher punishment, not 6 months itself. It carries higher punishment. Now, in this case, the minor, the victim, the child should be examined as per 164 CRPC, 164A CRPC, that is the older one. Now, when we talk about BNSS, it has to be 184 BNSS. Provisions are same, right? Consent is mandatory or not? Consent is mandatory. Without consent, you cannot go ahead with the procedure. You cannot force. And whenever you are asking, you are doing the examination, it should be done only in the presence of a parent or any person of trust. Any person in whom the child is having the trust. In case of a girl child, the examination should be done only by the female registered medical practitioner. That is again very important. Female medical practitioner. A male doctor cannot examine. If this is a minor child, only the female doctor can examine. And these cases will be done in camera trial. Closed court proceedings will happen. Right? Just to protect the privacy and confidentiality. Which is not used as a chelating agent in the heavy metal. Right? We got 2 questions on that. Right? And another question was, the child was receiving blood transfusion. You want to give desferrioxamine. What is the level above which we have to give desferrioxamine? So there were 2 questions on the metallic poison. We'll discuss about the chelating agent. Right? So let us discuss about that. When you discuss about chelating agent, remember chelating agents are commonly given in the treatment of heavy metal poisoning. Only in heavy metal poisoning we give chelating agents as a form of treatment, because we have got to chelate the metal and excrete it out. When you see the action of chelating agent, you can see that this is the chelating agent action. Whenever you have a metallic ion, this metallic ion is not water soluble, water insoluble, so you cannot excrete in the body. Most of the heavy metals are cumulative poison. It gets deposited in the body itself, keeps on getting cumulative, keeps on getting accumulated in the body. Because it is not water soluble, the body cannot excrete it out. So the purpose of chelating agent is it binds with the metal, it forms a metallic chelate, it forms a complex, and this complex is water soluble. When this complex is water soluble, you can easily excrete it in the urine. That is actual action. Now we have a lot of chelating agents we'll discuss. Number one, we have something called British anti-lewisite. British anti-lewisite chemical name is called as dimercaprol. Dimercaprol. You can use it in many heavy metal poison, particularly you can use it in arsenic, you can use it in lead, you can use it in mercury. But remember, there are few poisons where it is contraindicated. What are the conditions where it is contraindicated? If the person is suffering from G6PD deficiency, right? You cannot give BAL because it might induce hemolysis. Not only that, if the person is suffering from iron poisoning, if the person is suffering from cadmium poisoning, not only that, if the person is suffering from organic mercury poisoning, you are not supposed to give BAL. Avoid. Should avoid. Now we have next one, that is EDTA. Calcium disodium EDTA. Calcium disodium EDTA. Right, when you see EDTA, this is also commonly used in many metals, arsenic, lead and all, but is ideally preferred in lead poisoning. Lead, right? It increases excretion of lead in the urine. That is the reason why if any person who's having renal insufficiency, EDTA should be cautiously given, very cautiously, right? Desferrioxamine. Desferrioxamine is a chelating agent. We use it for iron poisoning. When the serum iron is more than 500, right, you can see that they have given the value. When the serum iron is more than 500 micrograms per deciliter, the person is suffering from serious iron toxicity. Severe iron toxicity. When the person is suffering from severe iron toxicity, we can give this one, desferrioxamine, above 500 mics. We have something called DMSA. What is DMSA? It is also called as succimer. DMSA is also called as succimer. We can be given in three important metallic poisoning. One is M, another one is L, another one is A. You can remember M and A. Mercury, lead and arsenic. The next one is penicillamine. Penicillamine. The 2-D-penicillamine. We can give it for MLC. Mercury, lead and copper. Mercury, lead and copper. Particularly for copper, this is very commonly used. D-penicillamine. We don't use L-penicillamine, we use D-penicillamine. Remember, it is important. So in this question, which of the following is not a chelating agent? Pralidoxime is not a chelating agent. It is basically an oxime which we use it for OPC poisoning. So this is a question which is about the estimation of burn surface area. So very frequently you get this question in INI-CET. An industrial worker sustained burns injury to the anterior region of his chest, abdomen, to the right upper limb, circumferential burn on the right thigh. Right? So what is the percentage of total burn surface area? You can see, let's see, you don't have to know anything else. You just know rule of 9, that should be sufficient. Rule of LS is sufficient. When you see the head and neck, when you see the head and neck, it is 9%. It's an adult, right? Head and neck, it is 9%. When you see chest, it is 9 plus 9%, that is front and back is 9%. When you see abdomen, it is again 9 plus 9%, front and back is 9 and 9%. Upper limb, for the upper limb it is 9%. For the upper limb it is 9%. So front and back, including front and back, it is 9%. When you take front alone, it is 4.5. When you take the subdivisions of it, see front and back is 4.4 plus 4.5, is it not? When you take subdivisions, you can see arm, forearm and palm, you can say it is 2 plus 1.5 plus 1. So 2 plus 1.5 plus totally 4.5, front and back will be 9. That is lower limb. Upper limb. Coming to lower limb. When you talk about lower limb, it is 9 plus 9. 9 plus 9, when I say it is front and back both. Both it is 18, front and back 9 plus 9. When you see this subdivision, thigh, leg and the foot, you can say thigh will be 5, leg will be 3 and the foot will be 1. 5 plus 3 plus 1, totally 9. Right? Front will be 9, back will be 9. So this is the subdivision and the perineum will be 1%. So totally you will get 100%, that is rule of 9. Now what is asked here, you can see the burns was involving the chest, anterior region of the chest. They are talking about only the front. So 9%, 9. And anterior region of the abdomen. So another 9%. Right upper limb. They did not tell you whether it is front or back. So let's take that both front and back are affected. It is another 9. Circumferential burn involving the right thigh. Right thigh, it is 5. Okay. Circumferential means both front and back. You can take another 10. 5 plus 5, 10. So totally it comes around 37. The closest one is 36. That will be chosen as an answer. Okay, so you don't have to know any other method. Just know this rule of 9 properly. You will be able to apply this in the question, whichever way they ask you the questions on estimation of burn surface area. So these are the questions that was asked in INI-CET November 2023 session from forensic medicine and toxicology. So you can see that most of the questions are asked from the same areas where they tend to ask for INI-CET. So if you are targeting INI-CET, you need to target these high yield areas. That is more than sufficient. Right? And you need to know the extra parallel explanation so that if they paraphrase this question, if they ask you lateral questions, you'll be able to answer accordingly. Okay. Thank you very much. All the best.